City Week, ladies and gentlemen. Today I have the pleasure of being able to bring to you City Week via WebEx. And I am joined by three community activists here in our community that have really been on the front lines with the things that we're encountering, the pandemic here, the coronavirus 19, and they're for a very, very worthwhile cause. I'm being, first of all, joined by Ms. Yvonne Lopez, who is the Executive Director of Ark Refuge Ministries here in our community. Also, I have Renee Boykin, who works for the LaGrange Housing Authority, and also have on WebEx with us this morning, Susie Hammock from District 4 Health. Ladies, welcome to the show.
Thank you.
Thank you.
Well, it is a pleasure to continue to keep our social distancing from each other, but also to be able to bring some important information to our community. And I'm sure everybody is aware of this now and the environment in which we are currently in and the things that they can keep themselves safe. But we can never overstress it enough. And this is something that I think that you ladies are doing and had an idea of how you can continue to help people to keep themselves safe. Yvonne, if you don't mind, I'm going to start out with you. Talk a little bit about Mask It Up, Troup County, if you don't mind.
Okay. For me, the way I got involved in it was I was on a conference call with the mayor and Mr. Cruz, and we were talking about, the COVID-19 and what was going on, and it was mentioned that the county had all of these masks, and so I asked, why can't we have a campaign for giving out the mask, because it's very well needed, especially in the poor and disenfranchised communities, one of which I work in, the Calumet Village community, Calumet Park, and because I work there every day and we actually feed people who are homeless and just poor and so I thought that it would be a big expense for these people to try to provide masks for themselves. I went to Walmart and I saw that the price of masks there was like almost $18 for a pack of 25. And if a person had to choose between a pack of masks and having a meal for their family, they would have to go with the meal for their family. Okay. So it was a wonderful opportunity to get these masks to people who couldn't afford it and have a high risk of spreading COVID-19, because a lot of them have the frontline jobs, so they have to go to work. They're low-income jobs, so providing them with the mask would actually be helping cutting down on the spread of COVID-19. Okay. From what I understand, if you don't wear a mask, you're like over 17% chance of spreading it, opposed to if you do wear a mask, it's like 3% chance. Okay. So, am I going on too much?
No, you're fine. I mean, well, Yvonne, you know what? We can talk all day because I'm a talker as well. But I do want to jump in and get some other comments from the other ladies, if you don't mind. And I want to go to you, Susie, for a moment and ask you the question. And Yvonne was talking about the cost of masks and the importance of wearing masks, and talked about the percentage of the probability of being spread when you don't wear a mask. From the District 4 Health perspective, talk a little bit about the importance of wearing masks. And when you wear a mask, who is that protecting too, okay?
That's a really good question. So I think there's a misconception about why you wear a mask. A lot of people think they're wearing a mask to protect themselves. So you think you're wearing that mask, you're blocking any germs out, and it's for you. And you think, well, if I don't want to wear one, if I feel like I'm not at risk, I don't care, I'm not going to wear a mask because this is my choice, right? And I can understand why people think that. But the truth is, you're not wearing a mask to protect yourself at all. You're actually wearing a mask to protect the people around you. So that's why it's so important that everyone wears a mask. I can't stress enough what an impact it would make if everyone wore a mask when they're in a building. Okay. If you're outside and you're distanced, it's not nearly as big of a deal. If you're 6 feet away from other people and you're out in the fresh air, probably fine.
Okay.
If you're in the grocery store and you're in that closed-in space and you've got people all around you and you're not wearing a mask, even if you feel completely fine, you are still at risk of spreading it, because about 50% of the cases, is what they're guessing now, are asymptomatic, which means you don't know you're sick. You don't feel bad. You think you're completely fine. So when you're saying, I'm not wearing a mask, that's my freedom, I don't want to wear one because that's my choice, and then you're actually sick, you could infect someone's grandmother, someone whose child is immunocompromised that can't protect themselves. It's selfish to not wear a mask at this point. Our numbers are going through the roof. Yeah. It doesn't matter if you're comfortable or uncomfortable. You need to put a mask on your face if you're going into a building with other people, period. If you don't want to do that, you need to stay home, because this is going to keep going up, 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 up. There's no limit to this, guys. I mean, our hospital right now is okay, but if we really care about our frontline healthcare workers and we're calling them heroes and we're, flying over the hospital and everything, respect them by wearing a mask, because otherwise they're going to be overwhelmed eventually if we keep letting our numbers go up. So it's a huge misconception that you're wearing a mask to protect yourself. You're wearing it to protect your neighbor. If your neighbor's wearing a mask, they're protecting you. I always want to high five people in the grocery store when they have a mask on. Like, thanks, man, I appreciate it, because you're protecting me,
Absolutely.
So
okay.
It's important, and people don't necessarily understand that.
Very good. And you're talking about in large groups and where you have a large congregation. And Renee, I want to come to you now, because the Housing Authority has gotten on board with the Mask Up Troup County as well. And that is an area where you have a high concentration of individuals. Talk about the importance of you all being a part of this campaign.
Well, we feel like the importance of us being a part of this campaign is to make sure that we do provide the mask to our residents and the community as a whole. Again, as she said, this will help slow the spread. And as you're going out in the community or maybe coming in the office, this helps with us as the workers as well, so that we are not, so that we won't be compromised as well either. Okay. But I think the importance of this is just to make sure we're getting out the word, the importance of telling everybody to make sure that you do wear your mask to slow the spread, because as you said, the numbers will keep rising and rising. And with the community that we serve, it is a dense area where people are kind of in one small area together that may still visit each other's homes. So if you are visiting each other's home, I would suggest you still wear the mask. As you said, it's not just to protect you, but it's also to protect the other person that you are around.
Okay, all right. And let me ask you, and I'm just going to throw this question out, and ladies, any one of you can respond. How many masks have we received here in Troup County, and how many do we expect, and what's the goal of Mask Up Troup County?
I can tell you what I know, and there may be others that you guys know about that I don't. Okay. We received 60,000 masks last week through our EMA. And then we're getting an additional, it's either 8,000 or 9,000 this week, but I can't remember which, if it's 8,000 or 9,000, but that's what I know of. And there may be others.
Okay. Let me ask you, what are some of the distribution locations that you all have already given masks out, and what are some areas that you all are looking to go to, Yvonne?
Well, of course, we're giving them out at the Ark. I understand we're giving them out at some school locations at lunchtime, the Housing Authority, and some other venues. But I would like to see them giving out at different stores. Okay. And make it mandatory.
Yes. For
people, talk to the owners or whatever, and make it mandatory. You can't come in the store without a mask.
Yes.
This, like April was saying, this is it's a pandemic, it's a crisis, and a lot of people aren't taking it as serious as it is. Myself, I'm in a high risk category because I have underlying conditions and I'm over 60 years old. So I'm putting myself at risk every time I leave my home. And no one should have to be locked in their home. If everybody get together and do their part, if everybody wear a mask, the elderly can come out, people with underlying conditions can come out, and we can all, continue to live and thrive. But there's a few selfish people who will not wear the mask. Like April was saying, it's protect you when I wear a mask. And I feel kind of slighted when I go into a store and I have on a mask. I think so much about you and care about you and your health that I would wear a mask, but you won't wear one to protect me. That's I can't even understand that concept at all. But we have to do better. I'm sure April and
Renee, Susie and Renee. Yeah, no, I get Susie and Renee.
Can add some more to that, but I'm very passionate about this, and especially because of how it affects, people who are poor and disenfranchised, who don't have another way to deal with, trying to be healthy. They already, a lot of them don't have health care or sufficient health care. And then you're exposed to this virus and you can't even afford to keep up with masks that will not only protect your family, but, in the long run, if your family and your friends wear it, protects you.
Okay.
So,
okay. Let me ask you, and Susie, I'm going to ask you this question because I know when it first came on the scene, it was attributed that some of the symptoms were maybe a dry cough, sneezing, things of that nature. And then we now hear that people can be asymptomatic, not display any symptoms. I've known people to say they've had various things such as maybe a sinusitis, a headache, things of that nature. What are some of the symptoms that we're now seeing outside of those that you might be able to give us?
Okay, so yeah, you're right. Initially, it was you're looking for a cough, a fever, extreme tiredness, body aches. It sounded a whole lot like the flu, and it was flu season. So everybody was very on edge in February and March. It was very stressful.
That's right.
And then it gets even more stressful because then they add to it, also you might lose your taste of sense, your sense of taste or your sense of smell. And then it's, also you might have horrible diarrhea or be throwing up, and it's like, it could literally be anything, So now, and basically, guys, it's not a conspiracy theory here. This is not the government trying to trick you into wearing a mask so they can control you. It's a brand new virus to humans. We're learning, and things change. And depending on your very own immune system, you're going to react differently than your neighbor. So if you've got a bad immune system, it might look very different than someone who has a good immune system. If you're severely overweight, it might look different than someone who's not. There are so many factors that contribute to what this looks like. There's really, if you have a cough, if you have a fever, if you're not feeling well, if you've had an upset stomach, if you're just feeling weird, if you've got a fever that keeps going up and down and up and down and up and down, these are good signs that you may have it. You may not. There are so many viruses that look just like this. But the great thing is we do have free testing. Public Health provides testing for free. You don't have to have insurance. You don't have to have any kind of proof of insurance. You just have to, you can call our call center, which I can give you the number for that. They'll direct you to our website. You click a little button. It takes you to a link where you answer a few questions, and it tells you where the closest testing site is, and it gives you an appointment. It's extremely simple. It's quick. It's taken about 3 to 5 days to get test results back now. And it's free. And then once you get your test and it says, okay, you're positive, just go home, find a room, preferably by yourself, and hang out there until you're feeling better. And then go get tested again to make sure that you're not still contagious.
Okay.
If you're not in a position where you can do that, just do the best you can. Wear a mask at home, right? If you have other people that have to be around, there's no choice. There's a lot of people that are in that position. They can't totally quarantine. Do your best to wear a mask, keep your hands washed, don't touch your face. It's all the stuff we've been saying over and over and over again. But those are the symptoms, but there is testing that's free. And if you think you might have it, just go get tested. Why not?
Absolutely. Yeah, and I will say that, you know, I went and had the test done, and it's not one that I would rush out to get done again, but to know the status, you know, I would endure that few moments of discomfort there. Renee,
little brain tickle, yeah.
That's right, that's right. Renee, let me ask you, because again, you know, heavily populated area, you guys have 2 locations there, and the things that you all are doing there in your community, Whiteford look remarkable. So I want to just say kudos to what is taking place there. With the things that we know and what Renee is talking about and what you all are doing there, how receptive have your residents been to masking up and other things, and even maybe urging them to get tests? How receptive have they been to those suggestions?
They've been very receptive. We did partner with District 4 Public Health. We did a screening on the property a couple of months ago. They've been very receptive. They're coming out, getting the testing, getting the mask. If they need any information, they are called to say, hey, where can I go get this? Or do you know where I can go get tested at? They do keep us informed on what's going on in their household as well. So they've been very receptive to keeping us informed of what's going on. If they have any questions or need anything, they do reach out to us. Okay,
very good. You know, because a lot of times, you know, I asked that question because a lot of times, like Susie alluded to a moment ago, say, oh, this is conspiracy, people, this, that, and other. But you know what? I mean, I've been around people and I've seen people that this is something that's real, because as you mentioned, is affecting people differently based on your makeup, your diet, and all the other various things. So, you know, I'm very happy that you ladies are definitely, again, on the front line and giving out the various masks that you all are giving out. Now, Yvonne, you alluded a moment ago that the Calumet area. Let me ask you, have any other communities, I know that we have some other communities that are basically kind of formalizing themselves. I don't want to call them out, but do you see this kind of catching fire over in other communities? They're doing likewise by asking their residents or neighbors to make sure that they get masked up as well.
Well, I've really been just focused primarily on Calumet because we do have a lot of people to cover in that area, and they're very familiar with the Ark. So we've actually been flagging people down in the street on the corner of Union and East Depot Street, passing out masks. They've been very receptive so far. We've given away about 1,500 bags. Okay. And about 500 left. So anybody who needs them, I tell them to just come by. You know, when we're actually, you know, giving them out in the community, sometimes we put a sign out, free masks. But if the sign is not out, still come to the office and ask for the mask.
Okay, all right. Let me ask you, Renee, because I've seen these masks and they're cloth masks. What's the care for cleaning them? Talk about that a little bit, if you don't mind.
Well, I know they're definitely reusable. I think it said that you can reuse them up to 15 times, and then you can wash them and reuse them again. But it do warn you when you're washing. I know a lot of people like to use Clorox when they're washing something white, to not use Clorox because you don't want to inhale that. Okay. But I can say, I know one thing is a lot of people usually say that the masks are uncomfortable and things of that nature. I tried one on personally, and I think they are very breathable, very comfortable. I actually like that compared to the ones I bought at home myself. But they are very breathable. like I said, you can wash them, reuse them. It comes 5 to a pack. So if you can use each one up to 15 days and rewash, that means you have you're able to use them for a while and not have to go out and purchase them.
Okay, very good. And and I want to ask you, Susie, about and Renee brought something, and I laughed about the discomfort of them. Again, what would you say to someone that say, "Oh my God, I just can't do this"? Because I think we probably have seen in the media where I think there was a gentleman that was wearing while he was driving, and you get some that may not necessarily be as breathable, right? And you kind of hyperventilate and pass out. Speak to that if you don't mind.
Oh my gosh, yeah. Okay, a couple of things. One, if you're in your car by yourself, there's literally zero reason to wear a mask, okay? If you're riding with someone else who doesn't live in your home with you, you should wear a mask then. Also, I see this a lot. People wear it with their nose sticking out of the top because they're like, I can't breathe. But you have completely undone any effort you just made to wear a mask. If you're going to wear it, keep your whole face, your nose and your mouth covered. And I get it. It's not comfortable. We have a policy in our building that if we're in our own office by ourselves, we don't have to wear one. But if we go out into the halls or if we go into someone else's office, we do have to wear one. I was meeting with a coworker the other day and we talked for about 2 hours and we both kept our masks on. And I was like very uncomfortable. By the end of 2 hours, I was like, oh my God, could not breathe. Uh-huh. And then you think of the people that are outside and it's hot. I get it. It is not ideal. Mm-hmm. I saw a thing the other day that said, what I wear every day that's uncomfortable is pants. And I don't wear them for me. I wear them for you. And I thought that is so true. We wear all kinds of things that aren't super comfortable, but we do it because we need to.
That's
and it's
right.
kind of the same thing. Just kind of think of it like wearing pants. Everybody needs to put their pants on when they go to the store, and that's kind of the same thing. It may not be them. This is temporary. This is not for the rest of your life. And if you would just put one on now, let us get through this, you won't have to wear it anymore. But the longer we resist and we say, you know what, nope, I'm not wearing it. I'm going to a barbecue with 600 people without a mask on. This is just going to keep going. Mm-hmm, and it's going to keep going and keep going. And we're going to drag this thing out forever. So if everyone would just wear one, we can get it over with and get on with our normal lives.
Absolutely. And that's a very good way of looking at it. This is just temporary. This too shall pass. But at this point, we all have to do what we can do to make sure that our community stays safe. Because as you alluded to, Susan, and we see that our numbers here in Troup County have risen over the last couple of days, weeks, and we can control that by social distancing and various things of that nature. Ladies, as we get ready to close out, Yvonne, or all you ladies can comment to this. What are some of the locations that you will be going to over the next couple of weeks that we can assist you all with?
Well, we'll be centralized in Calumet Village at the Ark. Mm-hmm. And I also just want to say, some people aren't wearing the mask or taking this thing serious because they feel like they don't know anybody who has been affected by COVID. But I like to say to you, keep not wearing a mask and you will. And one day it might be just you.
That's right.
So this is a matter of life and death. It's no joke. The science is real, and let's help each other get through this.
Okay, very good. Renee, closing comment from you?
I just want to say, we got the upcoming holiday coming up. So if you need masks to be around friends and family, as Susie said, you can reach out to them to make sure that you get masks so that you are keeping yourself safe. And then don't forget to still practice social distancing.
That's right. All right. Susie?
Yes, and that is a very good point. With the 4th of July coming up, if you're going to go to some sort of gathering, if it's outside and you can maintain your 6 feet, it's okay if you don't have a mask on, but keep it with you so that if you get a little closer or if things get more crowded, put it on. And don't be afraid to speak up to your family members and encourage them to wear a mask too. If you're in a room with someone and they're not wearing a mask, ask them, hey, why aren't you wearing a mask? I think once we normalize mask wearing, it will be easier for people to accept. But I think it's such a foreign concept to us. It's such a weird thing to put a mask on every day. And I think once people get used to seeing everyone with a mask on, you kind of feel like the odd man out if you're not wearing one, you know. But if you go out and half the people aren't wearing one, you don't feel so bad about it. It's like, well, you know. So I think just talking to your friends and family also is a good idea too. And we have masks here. I know Miss Yvonne said that the Ark still has about 500.
Okay.
Just give us a call and come get you a pack. It's a pack of 5. They're free. They're reusable. Get a pack. Share it with your friends and your family that need one too, and talk to them about the importance of everybody doing this together. Will slow the spread down before school starts back, y'all.
Very good closing points there. Ladies, I want to thank you all very much for what you're doing here in our community to make sure that Troup County gets masked up so that we can slow the spread of the Corona-19 virus down. And Susie, I like the point that you say, when you think about it as wearing your pants or your dresses or whatever other essential items that you have to put on before you go out in public, it may not be so bad. So ladies, thank you all. Thank you, Yvonne, for the idea. Thank you, Renee, for what you're doing there within the Housing Authority. And Susie, thank you for what you're doing at District 4 Health. So, ladies, always know that we're here as a resource to help get the word out about anything that you have going on in our community. So, again, I just want to say thank you for joining us this week here on City Week.
Thank you so much.
All right. Thank you all.